Hi, here I am in Orlando, Florida at the annual American Society of Hematology, or ASH meeting. Now this is where all the latest breakthroughs in leukemia treatment and hematologic malignancies occur. And I'd like to talk to you about an interesting agent that I personally have been working with at my center. IMGN632 is a novel agent. It's an antibody-drug conjugate against CD123 expressed on acute myeloid leukemia cells as well as BPDCN cells and other heme malignancies. This antibody is attached via a linker to a cytotoxic agent, a DNA damaging agent with high potency. And this data is being presented in a phase 1b study looking at the original results of the first 74 patients with AML and BPDCN treated with this agent, looking at toxicity and safety and obviously secondarily efficacy. Why is this agent particularly important for AML? Well, out of these 74 patients treated on 2 different dosing regimens, there was marrow reductions of leukemic blasts in about 55% of patients. About 20% of patients actually had a documented complete remission, a complete remission with incomplete count recovery. And of those patients that responded, many of them had received multiple lines of therapy. About 2/3 of them had received prior cytotoxic therapy. Many of them had adverse cytogenetics and molecular features, secondary disease, and a proportion of them actually had refractory disease. Now, 55% blast reduction is nothing to be sneezed at, but when we look at the side effect profile, we're really impressed as well, and that it was very well tolerated. The recommended phase 2 dosing is going to be maybe 1 day out of every 21, a single infusion. There was cytopenias, there was no dose-limiting toxicity, there was 2 cases of reversible VOD, and so looking forward, this might be an ideal agent, given once every 21 days, to be added on to other regimens. So trials looking at our new standard of care, venetoclax, HMA therapy, could this be added on to that? There's a lot of potential for this to be an important component of an effective combinatorial AML therapy in the future.